From Patient Care to Platform Creation, Why I Left the Clinic to Build XR Tools for Rehab by Emily Davis, PT, DPT. For over a decade, I worked as a physical therapist, shoulder to shoulder with patients who were fighting some of the biggest battles of their lives. Stroke survivors learning to walk again, traumatic brain injury patients working to regain balance, individuals struggling with dizziness, double vision, or post-concussion symptoms just trying to feel normal again. To this day, I remember every single one of them, their faces, their stories, their breakthroughs and setbacks. I often find myself wondering how they're doing now, hoping they're living fuller, more independent lives. Every one of them still holds a special place in my heart. Helping people heal became a part of my identity long before I ever stepped into a non-clinical role. But over time, the job I loved began to change. Documentation started to take over my evenings and weekends. Hours I once spent brainstorming creative treatment plans or researching new interventions were now consumed by EMR templates, billing codes, and insurance justifications. The shift was gradual but undeniable. Productivity targets became more important than patient outcomes. Time with patients became shorter, more rushed. Clinicians like me were pulled further away from why we entered this field in the first place. I reached a breaking point when I realized I was spending more time writing about patient care than actually delivering it. And that led me to a difficult but necessary question. How can I continue helping people, but on a bigger scale? My journey into immersive healthcare started like most big life changes do, with curiosity and a little bit of hope. I started learning everything I could about XR extended reality technologies, virtual reality, VR, augmented reality, AR, and mixed reality, MR. They weren't just for gaming anymore. There was emerging research showing real, measurable benefits for rehabilitation, improved engagement and motivation, better adherence to therapy plans, objective tracking of patient performance, and neuroplasticity-driven tools for motor, cognitive, and visual rehab. The more I read, the more excited I became. XR wasn't just technology for the sake of technology. It was a new way to deliver care, one that could actually solve the problems I'd seen firsthand in the clinic. Leaving the clinic wasn't an easy decision, but it was the right one. Now I spend my days working alongside engineers, designers, and fellow clinicians. I help translate clinical needs into immersive experiences. I review every app and activity with the eyes of a therapist, asking, will this make sense for a patient with balance deficits? Can a stroke survivor with limited arm mobility use this comfortably? How can we make this engaging enough to keep patients coming back for more? I've learned more about game development, UX/UI design, hardware management, and data analytics in the past few years than I ever expected. And through it all, my clinical background has remained my North Star. Because at the end of the day, it's still about patient outcomes. What keeps me going is the realization that every XR app we build, every feature we release, every update we push live, has the potential to reach hundreds, maybe thousands of patients. Patients who may be discouraged, patients whose therapy hours are limited by insurance, patients who just need one more tool to help them stay engaged and motivated. And for the clinicians still on the front lines, I want to build tools that make your day easier, not harder. XR can't replace therapists, but it can empower us. It can extend our reach. It can give our patients something fun, measurable, and effective, without adding more to our documentation workload. Every time I sit in a design meeting or review a product roadmap, I'm thinking of my former patients. I'm thinking of the stroke survivor who needed just one more repetition, the vestibular patient who struggled to stay motivated through weeks of exercises, the TBI patient who smiled when therapy finally allowed them to feel a sense of independence. This shift from direct care to XR development wasn't about stepping away from patient impact. It was about scaling that impact, about helping more people smile at their progress, about being part of something bigger. And honestly, I wouldn't trade it for anything. If you're a therapist feeling the pull towards something different, if you're questioning how to help more people without sacrificing your own well-being, know this: there's technology out there, built for you, shaped by clinicians like you, that's making a real difference in patient care. The best care doesn't have to mean more hours or more burnout. With the right tools, it can be right at your fingertips. Don't give up on technology. Don't assume it's out of reach or not made with you in mind. your clinical insight matters more than ever, whether you're helping shape these tools or simply choosing to use them in your practice. Because at the heart of every immersive app, every line of code, and every new rehab platform is a simple goal: to help you help your patients better, faster, and with more joy along the way.